So good morning, everybody, and welcome to this very first Horizon Europe Info Day for the Cluster 1, which concerns health research. I am Irene Norstedt, and I am the Director for the People Directorate in DG Research and Innovation. The Health Cluster of Horizon Europe is the result of a very close collaboration between my services and those of DG Health and Food Safety, which we call DG Santé. And I would therefore very much like to give a very warm welcome to my co-chair for this cluster and for also the session this morning. So this is John Ryan, and he is the Director for Public Health in DG Santé, and he will also address you in a moment. So if I can have the next slide, please. The purpose of this event is to present you with the 2021 work program through the dedicated information sessions where you will become familiar with the cross-cutting general issues of the health cluster and the 24 topics on which proposals can be submitted. And you will throughout the day also have opportunity to ask questions. And we will start with a session that focuses actually on the cross-cutting general issues and how you can receive support for applying to this program. During this morning session, we will not take questions on the 24 topics that are currently open, so please keep those questions for the sessions afterwards. And you will have specific sessions that will cover those later on during the day. Many of you may have attended National Information Days organized by national contact points. And so here I also especially welcome Katerina Buonocore, Elena Domenech, and Zlatuse Novotna, who will present the support services that are available also for you. Please note that next Monday, the 5th of July, there is also a brokerage event, which is organized by the national contact points. And this can help you to share ideas for potential project proposals and also where you can find partners for complementing your project consortia. And it's still open to register. Before we go any further, I would like to do some household messages for you. First of all, this meeting will be recorded, and the recording and all the presentations will be available on the InfoDay website. And I think you do have a homepage on the slide there. So it's horizon-europe-infodays2021.eu. You can use questions via Slido. And the Slido Q&A using the hashtag or the QR code that is shown on the screen right now. So please, this is the way that we will communicate with you today. So please put your questions there. And remember, you can also vote on questions that other people have posed. And of course, they will then move up in the priority order. So please use the Slido. With that, I think that we can start going on into the more sort of wider presentation of Horizon Europe. So if I could have the next slide, please. So Horizon Europe has a much greater ambition to create impact that is meaningful for the citizens and the union compared to previous programs. Sustainability is an ambition that cuts through the political priorities of the Union, ranging from ecological sustainability under the European Green Deal until the societal and economic sustainability in the economy that works for people. The Commission expects that research and innovation under Horizon Europe contributes to the sustainability, the Union's commitment to sustainable development goals, and the Union's future as the green, digital, and resilient society and economy. Public investments under Horizon Europe should deliver research and innovation to create public benefits. And this includes creation of jobs, economic growth, and industrial competitiveness for Europe. Next slide, please. Horizon Europe is structured in 3 pillars. The first pillar promotes excellent science. Most of the bottom-up part of the program is there with the European Research Council, Marie Curie actions and research infrastructures. The second pillar tackles global challenges and promotes industrial competitiveness. It counts 6 clusters, each cluster addressing a particular challenge. A third pillar fosters a dynamic European innovation system through the European Innovation Council, EIC, and the European Institute of Technology, the EIT. And finally, we have a horizontal part of the program that aims at widening participation and spreading excellence among the participating countries. The health cluster that we will talk about today is part of the second pillar. It has a budget of 8.2 billion euros over the 7-year period that Horizon Europe will be running. And the health cluster is mainly funding collaborative research and innovation actions, so-called RIAs, in response to call for proposals on specific topics. These topics address key challenges and opportunities the Union is facing and on which research and innovation is expected to develop and deliver the knowledge and know-how to shape our future. However, health research and innovation is also supported in other pillars and parts of Horizon Europe, and actually also in the Euratom program, which concerns nuclear medicine and diagnostics. So this is really important to remember. So while the health cluster, of course, is specifically addressing health, you will find opportunities for financing health research under all the different pillars. So please have a look around because there are many great opportunities there. So next slide, please. So Horizon Europe has a strategic plan that is a 4-year plan, and it directs the research and innovation efforts towards impact and challenges where the EU has a clear added value in order to build the future that we want. This is translated at the level of work programs as destinations, topics, and expected outcomes of the research. And the first work program was actually published on the 16th of June on the European Commission's Funding and Tenders portal. And the 2021 calls for proposals were launched on the 22nd of June, and they are open for submission of proposals until the 21st of September. So remember that is an important deadline. With that, I will actually hand over to my co-chair for Cluster 1, so to John Ryan. And John, I hand over to you for the next part.
Thank you very much, Irene, and good morning, everybody. And it's a great pleasure to be able to speak to you this morning. I have been working closely with colleagues in research in order to develop the common ideas for implementing the Horizon Europe program, but also the public health program, the EU for Health program, which we're launching more or less at the same time. So I think this joining up of the two policy areas, research and public health, can only bring benefits to citizens, but also to our administrations and to researchers. Now, the COVID-19 pandemic, which we're living through, has changed the way our societies are working, how we live. It's forced us to rethink the way we manage and deliver public health, care, treatment, prevention, so on. From a public health perspective, the scale and speed at which the COVID-19 pandemic took hold in Europe has highlighted the need for more effective mechanisms to manage cross-border health threats at European Union level, but also at the international level, of course. And in many cases, it's exposed structural weaknesses in our health systems and in our supply chains, our pharmaceutical supply chains. It's also shown a lack of investment in crisis management and in preparedness. The importance of a coordinated approach at European level and the limitations of our current legal mandate on public health were also, I think, demonstrated by this outbreak. And from the very beginning, the European Commission has worked closely with health ministers, the pharmaceutical industry, with researchers, with our different agencies, the Centre for Disease Prevention and Control, the European Medicines Agency, and so on, but also with our trade partners internationally, with civil society, with the medical associations and patient groups, to ensure a coherent approach as best we can and to address bottlenecks. Now, looking forward, our teams will continue to work together to strengthen the supply chain for medical countermeasures. We're hoping to launch this year a European Health Emergency Preparedness and Response Authority. It's a long title, but basically the idea is to scan the horizon for upcoming threats, to invest in research into countermeasures, to encourage the manufacture of those countermeasures in Europe, and then to stockpile the products in question so that we're ready for future threats. A second point I wanted to make is that this development of the Health Emergency Response and Preparedness Authority will, of course, have a big impact as regards antimicrobial resistance. So I think it's important that the colleagues who are working on research into antimicrobial resistance keep a close eye on these developments. Now, one of our efforts between research and public health has been to draw the links with the policy developments and the research program. And I'd like to mention in particular a couple of initiatives which are ongoing. The first is the strengthening of our legislation on cross-border health threats, which will cover, for example, things like preparedness, risk assessment, risk management. It will also strengthen the mandates of our two principal agencies, the European Medicines Agency and the European Centre for Disease Prevention and Control. And all of these three instruments, these legal instruments, of course, need to have appropriate research support. And one of our ideas has been to try and identify these areas and to work with the colleagues in the research program to make sure that these elements are sufficiently highlighted. Secondly, we have launched as well a pharmaceutical strategy for Europe. This was launched last November, and I'd recommend that you have a look at this document because it sets out some ideas concretely for improving not only the pharmaceutical legislation, but also the, I would say, the supply side for pharmaceutical innovation. There is at the moment a major effort being made to increase the supply of COVID therapeutics. And we're working with not only research, but also with clinical trials, with the manufacturers, in order to try and speed up the development and approval of new COVID therapeutics in the short term. The cooperation with national medicines agencies and the pharmaceutical industry, which we're looking at the moment, is really an effort to try and make sure that the international supply lines are as secure as possible. We saw last year, for example, major breakdowns in the security of our supply. And while we're waiting for these long-term instruments to kick in, we want to try and make sure that in the shorter term, that we do what we can with the industry to encourage security of supply. The Medicines Agency obviously has a big role to play. One of the major initiatives of the Commission in Health is the Europe Beating Cancer Plan. This was launched in February and it has a very strong component of research. There will be a component of research contained in a future mission of the cancer plan, of the Horizon Europe program. And this will ensure that there's a link between the policy objectives of reducing cancer and the research agenda. That's a major area of work, and I'd recommend that you look through the work program to see, and through the cancer plan indeed, to see the areas where the Commission and the Member States are working together to fight cancer. And finally, I would mention the whole area of Digital Europe and e-health, where the Commission will be proposing a policy paper later on this year, and where the research component is obviously very important. Now, we're also trying, in addition to all of these links with policy, we're trying to make linkages between our financial instruments, and the EU for Health programme has been substantially reinforced compared with the previous health programmes which existed before. And therefore, we're trying to make sure that there is a clarity between the investments in research and the investments in public health through these two separate programmes to make sure that the funding is complementary. And we have, just in the last 2 weeks, published the first call for proposals under the EU for Health programme. And I encourage you to have a look at this health programme work plan so that you can see what opportunities are there. Perhaps they're relevant as well to promote and implement some of the results of your research. So I would look forward to hearing from the colleagues later on today. I'm very excited about the launch of this Horizon Europe work programme, which we have helped to develop maybe more than in the past. So, and thank you very much to my colleagues online who've helped us to do that. Thank you, Irene.
Thank you very much, John. Then I would like to introduce our colleague Gianpietro van de Goor, who will tell you a little bit more about the funding approach for health R&I. Gianpietro, over to you.
Yeah, good morning. Thank you, Irene. So as already pointed out by Irene, with Horizon Europe, we want to achieve more impact, and we want to be more clearer in the impacts we want to achieve on the long term for shaping the future of Europe. So if you look into the work program in the description of topics and so on, you will see that some words are appearing. And I will try to give some more, let's say, meaning to those words that might be new to you. I've put some of those on this slide, and maybe we can move to the next slide because I will use those words in my presentation. Next slide, please. Yeah. Now the impact orientation that we want to have, or that Horizon Europe is designed for, basically consists of different layers which are trying to translate in a way that it is understood by research, especially also on what we want actually to achieve. We have, of course, on the first layer, the political mandate that has been provided by the Parliament and the Council, the legislation, which is clear on what Irene presented with the overview, with the structure of Horizon Europe and the budget allocated to Horizon Europe. The second layer is the first step into the implementation that we have worked for, the so-called strategic plan, which is a 4-year plan, in actually to identify the areas where research and innovation can contribute to the impacts we want to achieve related to the global challenges, related to the union policies. And we have identified in this strategic plan for the cluster health the expected impacts we want to achieve. These are then translated and giving orientation to actually how we are doing that by supporting research. So what are the topics, what is the research that is needed, that needs to create results that are then used by the users to, in the end, create on a longer term the impact we want to achieve. Next slide, please. See, I have to move also. Now, on this slide, I have tried to put in a nutshell a little bit the essence of the way that our cluster health work program is structured. As I indicated, we have identified expected impacts in the strategic plan as the strategic orientations that are defined for, in the end, Horizon Europe as a whole to achieve the different levels of impacts that we want to achieve. For health, of course, we have specified in the terms of health and well-being for the people, and specifically identified 6 expected impacts that are now in the work program identified as the destinations. So the goal that the research and innovation that you are going to perform, that we are going to fund, are contributing to. So one main element of novelty because of that is, of course, that we have tried to be a little bit more explicit and much more, let's say, oriented towards what makes a sense for you, or what makes meaning for you in describing that in the strategic plan, but then especially also to recalling that in the work program. The work program is just a 2 years work program. So what we have actually described in the strategic plan is 4 years. So you might not see everything covered in this work program. We will have a new work program, which will then address the other types of impacts identified under the 6 main headings. Now, for the topic description, for those who are familiar from Horizon 22, it has some consequences. A first consequence is, again, that we try to be more broader in the description, and more focused on what we actually want to achieve, what we are expecting research and innovation to create as output. We don't touch on, but what research and innovation is creating as outcome. And I will come to this difference between output and outcome in one of the next slides. But first, let's keep here. So we have actually created a logic that should make it easier for you, I hope, or we hope, to describe and make actually a value proposition in your proposal, meaning to clearly outline what is the benefit you want to achieve with your research, and the impact that in the end it should create for the wider society. So now on this pathway to impact slide, which is actually a concept that is also known as log frame input, output, outcome, impact. That's quite an established approach in project management. Origins are in development cooperation, but I mean, in the end, it's project management. And basically it is there to make a logical narrative between what you put in, what you create as output, so the research results in the case of a research project, and how then this output, the research results or the innovation that you have developed, can immediately make a difference to the users. So how the users are able to use that and create benefits for themselves. And this interaction between the developers, the researchers, and the users of the research, we see that as a productive interaction that needs to be, let's say, prepared for, and creates then the so-called outcome. And it's then only on the long term that the society actually will see the benefits from this outcome. So if maybe we can move to the next slide, just to illustrate. So here just a few examples. Important here, this is simplified, of course, and that's, of course, always the issue of a strategic plan, but also of a work program. We have somehow to simplify. And of course, it's up to you then in the research proposal to provide more, let's say, flesh to this bone, or to this backbone that we have created, to this, let's say, directions that we have formalized, and make a clear case for your project. So now for the output, in research, this can be knowledge, understanding, methodologies, technologies, and so on. Regarding the outcome, there, of course, you need to link your research and innovation results to the user groups, to those who in the end should use the results. And I have highlighted that in bold. So this can be citizens who can maybe directly benefit from the understanding that you have created, or the recommendations that you can give to citizens in taking better choices regarding their lifestyle or behaving, so that they can live healthier or are empowered to manage their own health. It can also be recommendations or tools that allows healthcare workers to work more efficiently, save time, also helps care providers that can manage then their services in a more effective and more accessible way to the patients, to citizens in general. And then in the end, of course, it should have an impact on the wider society, so that citizens live longer, healthier, have less disease burden, that healthcare systems are financially more sustainable, more accessible to people, or that the health industry is more competitive globally, more resource efficient, and so on. Next slide, please. Now, just to recall a little bit for the cluster health, what the funding modalities are, so the way we are providing funding. And I think that the most important ways that I want to highlight there are, of course, it's grant-based funding for collaborative research and innovation projects. So to consortia, to teams of researchers who are working together to address together in a multinational, multi-sectorial consortia, a specific topic that is open for submitting proposals. Another way that is also in this work program is to give contracting authorities, so who are usually procuring services, grants, complementing grant to invest in the more risky area of providing research services, and then in the end, possibly to have innovative procurements that they could procure. So that's another area which we think is very important to support. And then we have grants that are less important for the cluster health, but we have them in other areas, grants for individual researchers, ERC, EIC, Marie Curie Sklodowska Curie Action Program. Then we have partnerships, but partnerships is more for bringing investors and funders together so that they align their funding agenda and basically create a new, let's say, opening for researchers to receive grants or apply for grants. Then we have, of course, also the missions. And only recently, this week actually, the get-go was given to the mission on cancer. We had some two preparatory actions for the mission on cancer, exploratory actions that was included in the work program on missions for this year. There will be an update, and now a fully fledged work program will be established to actually implement the mission on cancer. Another area that you will see has quite a prominent let's say, occurrence in the work program as well, but in general that we want actually to achieve more synergies with other funding programs. And this is directly linked also to our impact orientation, to our aim that we actually achieve the impacts with the investments of the Union, also through other EU programs. And the goal there basically is, on the one hand, of course, such investments can increase, let's say, the infrastructural or logistical resource capacities in European countries. There are some programs like regional programs who do that, but we have also an opportunity to actually make a kind of follow-on funding. So once the research and innovation results are delivered, these other EU programs have the potential to support and promote the uptake of those research results and innovation. And we are working on that. So we have we have made an effort to make sure that these programs are financially, legally, in the way they are administered, more compatible. The next stage that we have now to work hard on is that we make sure that we create a certain alignment. I think we have not yet achieved that with this work program, but you can expect that with other work programs, this kind of alignment will become more visible. Also because the other EU programs are not yet at that stage, have not yet started like Horizon Europe has done now with the first call. Next slide. Now, regarding timelines, I will not go into details. I think for you important is to keep in mind the closure day of this call. There will be a process of evaluation informing you on the outcome, start of grant preparation in the course of first quarter of 22, and then signature of grants, of the first grants expected in April 22. So a process that takes some time, but I think that's a quite short and clearly timed process. And next slide, please. Now, you will hear more about support services later in the morning. Maybe here just a hint on what you can do to keep informed. You can register to receive the latest updates. You can reach out to the national contact points. We will hear more about that later. And of course, there's the EC funding portal, which is where you get all the information, where you can, for instance, also register yourself to become an independent evaluator. Should you decide that this time you don't have, let's say, the time, or you have not the resources to commit to a research project, you could instead become an evaluator and learn a little bit about the process on how we are evaluating and selecting proposals based on the peer review process. And then you find here the links to the different documents that are important and the website. And with that, I would like to conclude. Thank you.
Thank you very much, Gian Pietro. And I think this presentation shows the logic behind the work plan. So I think it was a very interesting presentation, but also you hinted at some of the support mechanisms for future applicants. With that, I'd like to hand over to our next speaker, who's the head of unit for health research in the European Health and Digital Executive Agency. It's a new agency. Stefan Hogan, you have the floor. Good morning.
Good morning, John. Thank you. Good morning, everyone. It's a pleasure to be with you this morning to speak a little about the new Health and Digital Executive Agency, HDEA for short. Like all European executive agencies, it was set up and supported by the European Commission to manage its funding programs. So HDEA will specifically implement, as you can see in the next slide, it's the EU's funding programs in health, in the digital space, on food safety, on industrial research, and space. The total budget to be managed by HDEA over the next 7 years is just over 20 billion euros. We're currently staffing the agency. We're up to just under 300 colleagues right now, but we will need to grow to the full 500 by 2027. And this will happen rather quickly. And with the next slide, please, I can tell you a little bit more about what its aims are. The aim is to address the Commission's ambitions to rebuild a post-COVID Europe, which will be greener, more digital, more resilient, and better prepared for the current and future challenges. It will work closely, it is working closely with various departments of the European Commission, the Directorates General, in the lead with DG Santé, and also effectively with DG Research, DG Connect, and others, which of course focus on the legislative and strategic tasks, while we will focus on the implementation of the programs. HDEA will manage 6 new programs, which I will present to you in a moment. As well as the so-called legacy programs, that is the ongoing projects from the previous program, Horizon 2020. And I can tell you that for health alone, we still have 530 projects ongoing, and many of which have just started, coming from the last call of Horizon 2020. Next slide, please. Yes, so here we can see the 6 programs. The EU for Health program, which John Ryan also referred to, the Single Market Program for Food Safety, Horizon Europe for Health, which will be the part that my team is dealing with in the Health Research Unit. And we also have our colleagues dealing with Cluster 4, the Digital Industry and Space Cluster. And then we have also programs, Digital Europe and Connecting Europe facilities. Added to these budgets will be the next part of the next generation EU funding, with 1.6 billion euros coming to complement the Horizon Europe funds. And in the next slide, you have another overview of this budget. And when we put together the next generation EU funds, we can see that we will be managing close to 6 billion euros for Horizon Europe in health alone, while our colleagues will implement similar funding for EU for Health. And we do plan to develop synergies with these other programs. So whilst the DGs, the Director Generals, will continue their work in policy making, in developing the work programs, which you will hear about today, we will be publishing the calls, we will be organizing the evaluations, we'll be preparing the grant agreements for the funded projects, and of course we will be monitoring and supporting these projects during their life cycle. And finally, we will also be trying to feedback some of the impacts from those projects back to our colleagues for policy making. So with that, I'd like to close with the next slide, to thank you for your attention today and tell you that we are standing by to receive your proposals from the first call. Thank you.
Thank you very much, Stefan. So this is a novelty for us in health research. It is the first time we are delegating the implementation of the program to the agency. Stefan, thank you for taking on this challenge, and we will work very closely with you, of course, in the coming years. And everybody online, I think, will get to know you as well as time goes by. It's now time for us to hear some presentations from some of the support structures that are available for you. And we will start with a presentation of the National Contact Points activities. And this will be presented by Caterina Bononcore. And she is the Italian NCP from APRE. And my Italian is not very good, but I will try again. Agenzia per la promozione della ricerca europea. I don't know, Caterina, how well I did that, but APRE is what we call your organization in all cases. And Caterina, the floor is yours.
Thank you, Irene. You went wonderfully with our agency. APRE is also the way we call ourselves, easier for everybody. So thank you. It's also a pleasure for me today to introduce to the research and innovation community the network of national contact points for Horizon Europe. All of us newly nominated, ready to work, ready to support you. It is important today to focus in these few minutes our role and the services, especially we can deliver to our research and innovation community. We would like to say as a statement today that we are totally committed, and I talk today, of course, on behalf of all the national contact points in Europe and outside Europe, that we definitely want to help this Horizon Europe program to be an impact-driven program. So really ready to take this mission side by side with our researchers and innovators in the different countries. I would like also to go on a very easy definition, because this network is existing since many years, always in every framework program. The network is there in trying to improve our services, trying to emphasize also the connection between and among the members of this network. So it's a network of people, mainly nominated nationally. I will say something about it a bit later. All the national contact points for Horizon Europe are in the member states, in the associated countries, and of course also in third countries, so outside European Union. So this is really guaranteeing us that we can work and support our researchers also by sharing experiences, contact with the other colleagues in the other country. In this slide, you see there is a link which is now on the funding and tenders portal. Very important, because we have in there already the list of newly nominated national contact points in your country. So my first advice is to check on this link and look for the national contact point in your country, which can assist you also in your national language, of course, with a national knowledge of your RNI system. You see on the other side of the screen a portal. It's the Health National Contact Point portal. At the moment is, let's say, not updated, but in a few months we will be ready to relaunch it and feed it with information. Some facts, just to clarify really what we are nationally nominated, so all the national contact points are in general, most of the times in public organization, ministries, but in some other cases also in private organization, like in our case. We are a community, we believe in the community feeling, and we are there to help health applicants in cluster 1 especially, but of course we also want to coach or give you orientation when it comes to placing your research and innovation ideas even in other research opportunities related to health. Today we you mentioning the new incredible program EU for Health. So we are ready also to basically give you advices on where your idea can fit. In the link in green, you see our guiding principles, because we all work with the same standard, with the same way of delivering services. Some now more into details information about what we can do for you. Of course, you see the first fish. We have been already doing some information days in the respective countries. So we have done already side by side with European Commission some delivery of information on the new program. Now we are ready with the launch of the call to go with you into the topics and into the proposal preparation, so we can assist you also on this very challenging task for the deadline of the 21st of September, and from then also over. Then you know that also our cluster 1 is complex in terms of ethical issues, clinical aspects. Also in that case, National Contact Point can support you with the right advices. You see one of the fish is dedicated to partners, assist you in your search for partners. This is very true. You can always come to us with a request of a specific expertise in our country or outside, and we look for these researchers for you through the National Contact Point in the other countries. Very important, as Ms. Nortet was mentioning in the beginning, on the 5th of July, we have organized, thanks to the support of a project called Bridge to Horizon Europe, a brokerage event. And I can tell you that yesterday we had 2,000 registered participants. Until Sunday at 5 o'clock, it's still possible to book meetings with new researchers, new innovators in the platform. So until Sunday, there is time. And until yesterday, we had already 600 validated meetings, and still 400 to be validated in these days by our colleagues. National Contact Point are actually validating also your profiles. So this was a very challenging first task in terms of matchmaking. Then I'm going to close by showing you the new portal for Horizon Europe that Bridge to Horizon Europe has created. This is a portal both for NCPs, but also for applicants. Especially in the middle of this slide, you see stage and store. In these two, like we call them doors, you can find information, guidelines, especially assisting you in the proposal preparation. The first document we published was actually a glossary on the new terminology that Horizon Europe has brought with it, and a business glossary for who is doing more market-oriented research. So visit this website and let us know what you think about it. You can search with different on a different product by theme, if you are an NCP or if you are a participant, and you will find very updated information, of course, very much in synergy with the Funding and Cambio portal. So this was the first information I wanted to bring forward before also saying goodbye and thanking you for hosting National Contact Point in this session. I would like to say, please contact us nationally, internationally. It's very important for us not only to give you the right information and advice, but it's also important that you give us your feedback, you talk about your challenges, to have a constructive approach in terms of how to better improve our services and how to better help you. My contact, and good luck for this very first competition on research and innovation. Thank you
very much, Caterina. This is really a wonderful set of slides you've shown, and great support for people who are interested in participating in the research program. And we're continuing a little bit on the same topic of national focal points. I'd like to introduce Elena Dominic, who's the coordinator of the Joint Action for National Focal Points, working in the Institute of Health Carlos 3 or 3rd in Spain. Elena, you have the floor.
Hello, good morning, everyone. It's a pleasure for me to be here today presenting this joint action. You can see the full screen, thanks. Okay, so this joint action on increasing capacities of national focal points. We are expected to start on the 1st of October. And I like to say that we are the coordinators, the Instituto de Salud Carlos III, together with the Ministry of Health, Spanish Ministry of Health, and also is co-lead with our Italian partners, the Ministry of, through their Ministry of Health, APRE and PROMIS. So, wait, I'm sorry, I can't. I don't know what's going on. Can I share properly my screen? No, okay. So just to give a little bit of context, so the new multi-annual financial framework for 2021-27 offers increased budgetary contribution for European recovery and the strengthening of healthcare system through a wide variety of action. One of these actions is the 4th health program, or EU for Health. So this changing situation makes even more necessary to count with a network of experts to boost this European cooperation and facilitate the smart implementation of the EU for Health program. So as EU for Health is not the only funding program or European program that work with towards research in health systems, we find necessary to work in synergy with other funding programs such as the Horizon Europe Health Cluster. And this synergy will allow this research done by this Horizon Europe to be taken up by the health system and to have a direct impact on citizens and in general society. So you can go to the next slide, sorry. Okay, so so these experts I mentioned before are the national focal points, or NFPs, which are the national expert for the health program in the member state and the participant countries. Those are appointed by the National Health Competent Authority that are usually the Ministers of Health. And through these appointments, member states will support the implementation of the health program by enhancing and increasing participation at the national level. So the roles for these national focal points are to be defined in this joint action. It is one of the objectives by the agreement of some common standards. However, the expected function of those that you can see there to promote the funding opportunities, advise and assist applicants, communicate to better understand the health program, offer guidance in identifying relevant topics to apply, disseminate an impact results and impact on the health program at the national level, organize information events, and most importantly, to build synergies with other health-related EU programs such as Horizon Europe. So as you can see, they have a very similar profile to the national contact points for the RNI framework program. And these NFPs has been working throughout the former health program and have proven to be a very useful advisory system to participants that operates at the national level and are capable to allow equitable participation across countries. So based on in order to establish a parallelism with the Horizon Europe, the DG Santé, looking at this national contact point networks, want to go a step forward with these NFPs and to help and invest in facilitating the work as a network for these national focal points. So in the next slide, as just an overview, a brief overview of this joint action. is funded under the third health program. And the topic is the 2020 work program, and is based upon some recommendation made after the evaluation or the midterm evaluation of the third health program. So the objective is to consolidate a sustainable network of NFPs that facilitate and support quality access to the EU for health funding opportunities, and to help increase participation in underrepresented member states. So how to address that? So we aim to develop and strength the capacities and skill of the workforce of national focal points, and while looking for complementarities with other regional, national, and European policies and health funding programs. So, as I said before, we are expected to start on the 1st of October, so we are under grant agreement preparation phase. And this is the first time that a network like that is going to be funded by a joint action. So in the next slide, you can see just some brief hints of the EU for Health program. So it was adopted on the 18th of June, and due to this pandemic situation, is a renewed and more ambitious one with more ambitious general objectives. And as you can see by the increased budget, 5.1 billion. And for this first year, 2020-2021, we'll have more than 300 million. So it's structured or organized by topics from the external action areas, and range with different funding tools that range from call for proposal, direct grants, procurement, etc. So the first working program was published on the 24th, and the first 5 calls that are under disease prevention, that is oriented to the Europe Cancer Plan and crisis preparedness, will open on the 29th of July for application. So it's executed by HADIA, and I'm sure you can find your country's NFP that we will be willing to help you throughout the whole process. So in the last slide, I will just to sum up the expected impacts of this joint action, which is, as I said before, to establish a sustainable network of NFPs that successfully implement the EU for Health program, establish a structure of cooperation or synergy among NFPs and NCPs, and this is clear, but this is emphasized by the fact that in one of the working programs, the working packages, is very focused on finding these synergies. And just in the last slide, to thank all the participant countries and institutions that we have in this joint action. Thank you.
Thank you very much, Elena, so for this good presentation as well. And we're very happy to see that you will work closely together with Katarina and the NCPs, because it's really important that we maximize sort of these support structures that we have and can guide the applicants in the right direction. As we have heard, we have several programs addressing health, so that's really good. So we will now come to the final presentation of this morning, and this is the presentation of the Alliance for Life. And the presentation here will be done by Zlatusa Novotna, and she's the coordinator of Alliance for Life, and she's from this, I think I pronounce it, we will see, Zajtek, from the Masaryk University in the Czech Republic. So Zlatusa, it's over to you.
Yeah. Thank you very much. Good morning and hello to everyone. Thanks a lot to the European Commission to having invited me to give a presentation and present to you the Alliance for Life Sciences. So you see that we are the project named Alliance for Life Sciences, from strategies to actions in Central and Eastern Europe. What we want to achieve with this alliance is joining forces in Central and Eastern Europe to improve jointly and to help closing the innovation gap in Europe, and especially in health research and innovation domain. We are 12 institutions. We cover 11 countries of the so-called EU 13. And with the second project, which is currently being implemented, we enlarge the alliance with Bulgaria and Romania. So as I mentioned, we have already a second project, and it will last until 2024. What's important is that our project is not only a project, it's really a permanent alliance. And here is a proof about the commitment of our management, the signing ceremony of the Memorandum of Understanding in Vilnius in 2019. We selected the partners or the members of the consortium very thoroughly because it was based on benchmarking analysis of scientific performance. And you can see that we cover both universities, also hospital and research institutions, member of Academy of Sciences. So it's really a nice mix of institutions. Our vision is, as I said, to help overcome the innovation divide in Europe, but more importantly, we are very open to collaborations. We want to serve as a role model of progressive health research institutions. We want to improve our governance and culture, also create a spillover effects and initiate national reforms in our countries, which are very needed. Therefore, we, as I said, are very open to collaboration and offer a lot of opportunities also to new partners. Here is our workflow of the new project. You see that we have several packages. I will not read everything, just mention that we start with mapping culture of for excellence. So we want to first identify the best performing researchers and so-called pockets of excellence, the talented people in our region. We want to offer these collaborations to the health research and innovation community in Europe. And we want also to have a say in European policy. We will issue a white paper about careers in our region. And we also want to create a relationship platform with European industry. And now coming to the most important slide is our offer. We start with a self-assessment. We want to share with you our methodology templates of our surveys if you are interested. It's available to everywhere to have a look at our website, for instance. We also, as I said, will issue a white paper on career models because it's very important for healthcare and health research to combine the roles of being medical doctor, being academician, and also scientist. We will organize meetings for our PhD students and early stage researchers, so you can be trainers and speakers at these events. We will also organize thematic mini conferences with our pockets of excellence, our identified researchers, and offer new scientific collaborations, especially for Horizon Europe. Therefore, this is our main objective, to create new consortia and new projects. You will have access to our CEE talents and also to our state-of-the-art core facilities. This is important because based on structural funds, we have a very good equipment in our region. So we will create an e-database of this equipment and related services and offer open access calls also to interested partners, including industry, of course. We will organize academy, research management academy. So we want to improve via training, and also skills academy for early stage researchers, especially in soft skills and transferable skills. And we will have a say, hopefully, also further in European research policy. We plan to issue positions, especially in the health and widening domains. And finally, we will organize these national roundtables, trigger events to facilitate reforms in our countries. And the industry relationship platform will offer priority access to all these opportunities to the industrial partners. So this is the offer. You can follow us on Twitter. We will be very happy to share with you our news, so you see our account. And I hope to see you later. Here you see my contact information, and we are very open and very keen in collaboration for future. Thank you very much. Have a nice information day.
Thank you very much, Zlatuse, for that information, and also very good services provided for all of you. So we now are ready to take questions from Slido. So please use Slido, and also remember that you can vote on questions which are already there. And we will already start. And the first question that we see on Slido is that is there a general calendar for Horizon 2021 that offers well, actually, it is Horizon Europe, but I think you mean Work Program 2021, that offers an overview of open calls, deadlines, when winners are announced, etc. So there I would advise you to go to the participant portal, where you will find information about all the open calls and the respective deadlines. You heard in the presentation earlier today the sort of tentative timelines for the Health Cluster Work Program 2021. So you can also go back and look at the recording of this one. And I think it may also be in the questions and answers that will be provided for you on the website. And then I don't know if any of the colleagues would like to comment. No, I don't. I see shaking heads. Then is the question, is there a possibility that deadlines will be postponed? And I would say that generally the answer is no, unless there would be something very unforeseen happening, but it's not something that you should count on and expect. So please prepare for the deadlines, and also remember to submit your proposals well in time. We know that it gets very crowded, so to say, online just before the closure, and we really would not like you to miss the deadline because of technical problems. So you do remember to actually submit ahead of the deadline, because that helps you make sure that your submission will go through and will be registered before the deadline. Then I think we have a question for John. John, great to hear that the cancer mission will go ahead. Do you know yet when might this step be formally announced, press release, website, etc.? And John, you are sort of the deputy mission manager for cancer, so I hand over this one to you.
Thank you very much. So in response, the cancer mission is one of several missions which are being finalized at the moment. We've been through an internal assessment process just in the last few days, and then a political decision will be needed to decide on the launch of all of the missions together. And then the procedure will be that there will be an amendment of the work plan to include the elements of the different missions in the respective work plans for Horizon Europe. And all of this will be happening over the coming weeks and months. So we don't have a date yet for the actual launch, but I can tell you it'll probably be a big launch, because it'll be it'll be a launch event for all of the missions and not only for the cancer one. So every mission will be launched as part of a package.
Mm-hmm. Thank you, John. And I think the next question is also very much for you, maybe. So what is the difference between the EU for Health and the Horizon Europe Health Cluster?
Yes, the EU for Health program is essentially a program which focuses on topics like resilience of health systems, the preparedness for cross-border health threats and major health threats, but also the implementation of the Sustainable Development Goals in health for non-communicable diseases, for example. So it's more, I would say, focused on a direct interface with disease prevention, disease treatment, disease control, whereas the research program is more devoted to, as the name implies, supporting research into health destinations. And we'll be having a session actually for the rest of the morning and this afternoon, looking into more detail at some of these research areas, for example, tackling diseases, reducing disease burden, health promotion and environments and so on. There is obviously a close link between the research that's done on the topic, but our EU for Health program is more intended to bring together people who are interested in implementing the results of research, I would say. So in that respect, there's a very close link between policy and research.
Thank you, John. We then go to the next question. What is the difference between national contact points and national focal points? Thank you. So that is for Elena and Katerina, maybe to clarify.
Yes. Well, we have to say that there is no actual difference because the role is exactly the same. We provide similar type of coaching services, but one network is totally dedicated to Horizon Europe, the other one to EU for Health, the new program, because we really feel that to assist really well, you should be really focused and know the program and the policies and the rest. So basically no difference, but we assist two different programs.
Yeah, exactly. I would say that the difference is we are focused on different funding programs, but basically the roles are very similar.
And we hope that you will work together also to make sure that the applicants find the right program.
That's the objective, yes.
Very good. Thank you. And then we have a question again. Are the calls for the European Cancer Plan going to be published as part of Horizon Europe? I think, John, you already answered, but maybe you will clarify once more.
Yeah, so the Europe Beating Cancer Plan is not only a series of initiatives to be financed from European programs. I'd like to emphasize that the Europe Beating Cancer Plan is a series of initiatives which also involve, for example, changes in policy, but also changes in legislation. And the idea is that the funding programs across the Commission, the different funding programs across the Commission, not only the research program, not only the health program, will be mobilized to support the aims of the cancer plan. May I give you a quick example? We have the issue of health and safety at work and carcinogenic substances in the workplace. We know that cancer is a major outcome of health and safety at work, and it's a major burden in terms of workplace related disease. Now, there is strong European legislation on carcinogenic substances in the workplace, and our intention would be to reinforce that legislation. But basically what we intend to do is not only to use legislation, which is of course the gold standard from our point of view, but also to make sure that appropriate research is launched. And this will be the aim of the cancer mission, which we were talking about earlier on, which contains a series of different areas of work, which we think is important to complement the objectives of the cancer plan. And the same thing for the EU for Health program. We heard, I think I mentioned earlier on, that just 2 weeks ago, we published the first call for proposals under the new EU for Health program. And this contains, I think, 4 individual items relating to cancer. So if you Google the EU for Health program, you'll immediately come up with the first call for proposals, and I'm sure my colleagues can also share the link with you. So in summary, the Europe Beating Cancer Plan is a mixture of policy, legislative and financial initiatives which over the lifetime of the cancer plan is intended to improve prevention, improve early detection, improve treatment and diagnosis and aftercare, and finally to improve the quality of life of cancer patients. And again, all of this will be much more clear when you have a look at the actual text of the Europe Beating Cancer Plan, which is available, of course, publicly. Thank you.
Thank you very much, John. Now I think this is maybe for Katerina. Registration of the health brokerage event on Monday seems to be closed. Would it possible to participate still?
I was mentioning before that the actual registration closed on the 30th, but we have been accepting still new entry in the portal until today. The colleagues are still accepting a few profiles, but I have to say that it's better to consider this as final today. We can give maximum 1 more hour to register because this will imply anyway validation. So in case someone is following and wants to submit really in the next hour his profile, we can accept it, but it's really exceptional. But the people who are registered can just book bilateral meetings until Sunday at 5. So now the main task is really to create bilateral meetings.
Thank you so much, Katerina. I'm sorry if you hear background noise from my side. There's some works going on with my neighbors, so it's a bit noisy here. I don't know if you hear it in the camera. I apologize for that. Now, John, there's another question here related to the EU for Health Work program. And the question here, if organizations are encouraged to participate in both programs, are there conceptual overlaps? John?
The answer is no, there are no conceptual overlaps. What there are common themes. And I mentioned to you some of the common themes earlier on in my presentation, you know, like resilience, improving the resilience and preparedness of our health systems. I'm sure there are research topics which are relevant for improving the preparedness and resilience of our health systems. But the types of project which would be financed under Horizon Europe might be more research orientated than the projects which we would be funding under the health program, as the projects we would be funding under the health program might already include the results of previous research. So we would not in the health program be funding research per se, would be more funding networks of member states, networks of organizations designed to implement a specific intervention. Whereas I think on the research side, it's more innovative research which will be called for. But on the same topics, basically, yes, you're correct. There is an overlap in terms of topics, but not in terms of the type of projects which are financed. And again, if you look at the types of projects that have been funded, Stefan Hogan was talking earlier on about the projects that were funded in the recent last few months and years in the Horizon Europe program, the Horizon, what was it called, 2021 program, I think, Iran.
I'm sorry, John, maybe you can take over. It's so noisy here, I can barely hear you. So would you mind taking over the questions for a while? I'm sorry for that.
I wouldn't mind taking over because I don't have the Slido in front of me, so I'm afraid
you don't have. Okay.
I'll be able to help you there.
Okay, I will try to, because I couldn't hear what you were saying, actually. I'm really sorry.
Maybe there's a colleague online who could.
Yeah, maybe somebody could answer the John had a question. Gianpietro, can you come in?
Yes, sure. So we had the question here. The first one is now on, it's actually a question for me. In various calls in the health cluster, a role for contribution of a JRC is indicated. Should they become partner? How should we implement this in the proposal? Maybe I can ask now the service provider to show the slide that we have prepared on that. Would that be possible? Otherwise, I start answering. So there are actually, on various topics, there is an indication that the JRC may participate as partner in such actions, proposals. Yes, here we are. So the important word is that may, because it's an optional possibility as a kind of add-on to a project proposal. Now, I think it's important here to highlight that we have changed a little bit the approach how the JRC can participate. First of all, the JRC won't be part anymore of the competitive part of the proposal evaluation selection process, in the sense they should not be part of the applying consortium. So, however, if it is indicated in the work program that the JRC may participate, you could consider, if you think it is beneficial for your project, to include the JRC as a potential partner in line with what is described in the topic. In the same line as not taking part in the competitive bidding, the JRC will also not take part in the competition about the funding, because it will use the funding from its it will participate on the basis of its institutional budget. So they will participate and sign the grant agreement as a beneficiary requesting zero funding. So I think this is an important element. Now, what does it mean now for in the practical terms? So for the cluster health, we have for 2021, we have 4 topics where the management of JRC has agreed that the JRC may participate. So it's actually endorsed by the JRC that these are areas where they are ready to allocate resources, so human resources and financial resources from their institutional budget. Second, now, how do you do that in practice? So first of all, it's a new way of working. So also the JRC is trying to learn how the best to do that. First of all, you should create a proposal that is more or less self-standing, or that is self-standing, so that can actually go into the proposal evaluation process. And you should indicate as a complementary part or activity the way the JRC could or should contribute into your proposal. So describe in your proposal already what you foresee for the JRC and what you think from what is described in the topic description, the JRC could or should contribute to a proposal. Once the proposal is evaluated and selected for funding, the discussion on the specific conditions of participation of the JRC will be negotiated between you as consortia and the JRC. And once there is an agreement and the grant agreement established, the JRC will sign the grant agreement. Now, this sounds still a little bit unclear, and yes, it is a little bit unclear because it's new to us also to work on that, and maybe I can have the second slide. Thank you. So because of this unclarity, actually there are 3 focal points that you could contact in the JRC. So Michaela Batorova, Milan Remak, and Maren Hans. These are the people who have indicated a readiness to answer questions, should there be questions. So you should not get in contact with the researchers at the JRC, but actually contact these people if you need clarification. Now, regarding participation of the JRC, there are actually 2 modalities. I already indicated the JRC can participate as a normal partner, signing the grant agreement as a so-called beneficiary requesting zero funding, which sounds a little bit strange, but we call that legally in this way. But the JRC can also participate in a lighter way, in a light form of collaboration, not going to sign the grant agreement, for instance, in a kind of advisory role in any scientific advisory board that a project might have, or any other forms of light collaboration, which would need to be seen with the JRC, how to do that. So this is, of course, also an option. The two differences is, in the first case, it needs to be mentioned in the topic. So the JRC can only participate as full partner if it is mentioned in the topic. The second option, as non-beneficiary, is possible in any kind of topic. So that's at least what I learned from the JRC on what is foreseen from their side. And if you have questions, please address yourself to the three contact persons. Thank you.
Thank you, Gian-Pietro. So I can take over. I think the works have stopped again, so I could hear you. I'm sorry. This is the reality of you cannot control. So the next question is, will there be additional calls for RIA and IA within Next Generation EU funds? So this is already included in our programs today. So there is not a distinction as such for you, so that is already there. Then we have a question, how can I find requirements for the number of participants and the roles in the project consortium? Well, the number of participants is part of the eligibility criteria, and this is all part of the publication of the calls. But maybe, Katerina, this is something that, because this is something you can help applicants with, this type of questions. Katerina? I'm not sure Katerina can hear me. Yes, you can. Do you want to add something to the question?
Yeah, Irene, but I cannot read the question. Can you reread it again? Sorry, because...
Yes, so how can I find requirements for the number of participants and roles in the project consortium?
Okay. Yeah, this would be really a task we can answer to, also because in the network of national contact point, we have also an extra network which was not mentioned today, which is totally dedicated to the legal and financial issues for Horizon Europe. So it's really well informed about the rules, the eligibility criteria, financial rules, and so on. So I would say, in principle, it's always good to contact the Cluster Health NCP and the National Contact Point for Legal and Financial Issues. We would give you these type of questions, of answers, sorry.
Mm-hmm. Thank you, Katarina. So now we have a couple of questions on international cooperation, and I think I will actually group them because in the interest of time, because we're coming very close to the end of this session and we will need to finish on time. And that is UK and international cooperation, etc. So the calls are open to any country around the world to participate. So that is something, it's a completely open program. So all types of organizations from around the world can participate in the program. Then it's only a question whether they would receive funding or not, and that you will find lists if you look in all the documentations with the call. And typically industrialized countries will fund their own participation in the program. So an SME from Japan, for example, would be funded from Japan, whereas an SME from a poorer country, so to say, can receive funding from this program. We have one big exception, and that is from the United States, where we do have a goodwill agreement with NIH. So applicants from the United States can participate and be funded in the program. And that also gives access for European participants in the NIH program. So that is really an exception for this program that we are applying. So I am afraid that we will have to close the session now because we have run out of time. There are several sessions this afternoon, so please continue to ask your questions. We will, of course, save the questions that you have also put in Slido so that we also can provide questions and answers that we will put on the website as well. So with that, we will also use and harvest sort of everything that you have put on the table here. So with that, I would like to say thank you very much for all the speakers that has participated this morning. And I hope you will be with us also this afternoon. There will be sessions for each one of what we call the destinations in the afternoon. And then there will be finally also a very important session on the essential information for clinical studies in Horizon Europe. And you know, there are special requirements there. So it's very important that you also listen into that session. So with that, I would say thank you very much from my side and goodbye. Maybe, John, you would like to have the final word of this session.
Okay, thank you very much, Irene. Thank you very much to all the colleagues who presented this morning. I hope the information that you received online has been useful for you. There's lots of material to read and lots of resources to dig into. And of course, later on in this session, we'll be going in more detail into the different individual destinations or our topic areas for health. And I look forward to those discussions as well. I hope it's been helpful for you and have a good day session. Thank you.